if a child has epilepsy, could it just be that their system is just overloaded, their lymphatic system is just overloaded
No, you need
and
more than that usually for epilepsy. You need to have some dysfunction in astrocyte. Probably we think it's astrocyte these days, connected with a neuron. And that could be from a scar, a hit, something like this, some kind of, a reason like that. So you want to usually work on the astrocyte. So not just, you could have something and the lymph is not working. And, the lymph is going to evacuate your glymphatic system, your venous sinus, and a lot of the CSF components are going to be found in the lymphatics also. So if you have really a stagnation of lymph somewhere and you have more inflammation, maybe you're going to irritate some astrocyte, and you can imagine, but it's probably you have something else that causes the epilepsy, and you need to work on your lymphatic of the face and neck, and usually it follows the large arteries. So the perivascular spaces, so around the arteries and the veins, and especially also along the cranial nerve and spinal nerve. So usually you have to follow those pathways. I mean, I wrote an article or two on those, so you can follow that. But it's usually, by drilling the face, the neck, the cranium, you're going to evacuate a lot of the lymph in the CSF, in the brain parenchyma, the brain tissue, the glymphatic system, the meninges, all that is going to the lymph, and you want to evacuate. And we think in physiological state, 60% probably of the component of the brain is evacuated by the lymph, and the venous pole with the arachnoid villi granulation is 40%. And if you have more pressure on your brain, if you have a hit, a blow, usually it goes more to the lymphatic side than the venous side. So this lymphatic side for anything in the brain is very important. For anything that you think in the brain, the lymphatic are going to be very important, for inflammation, anything you can. And already you can drain the face and the neck and a bit the cranium, and that's going to do a lot. And when you get more specific, you will go around cranial nerve, spinal nerve, and so even in the spine. So sometimes, you have problem here, but drawing a bit the spinal nerve helps, and along the large arteries and veins. But that's what you do. Usually the big lymphatic of the neck are along arteries and veins. So that's a way to drain the central nervous system. Does it make sense?
It does. And I was just starting to question the brain barrier, the
Blood-brain barrier.
Does the lymph?
No, because the blood-brain barrier is around arteries. So the most external part of the artery, the adventitia or tunica externa. And sometimes you have pericyte, the special cells along this artery. You have the space of 10, 20 nanometer. And then you have the end foot of the astrocyte. And the artery, vein, cerebral interstitial fluid, that's all you have. You don't have CSF. You don't have cerebrospinal fluid because you are inside the brain tissue. And you don't have lymph. So it's between artery, vein, and cerebral interstitial fluid. There's no lymph there. There's glymphatic system. That's why they call it the glymphatic system. It looks like lymph, but it's not lymph. And there's no cerebrospinal fluid, which is around the cells or inside the ventricle, but not so much through the brain tissue. It's called CIF, cerebral interstitial fluid. But that is going to be reabsorbed. It's going to go somewhere, and then eventually the lymphatic system is going to reabsorb all that.
Well, thank you for answering that.
And I wrote a few things that you can get on my website. Yeah, I just shared 2 seconds. So if you go on the website, right, online class, you have these red things, and you have it also here. This is USA Canada class. This is international classes. But now we are looking for articles. The best way for me is I go at the bottom and look for lymph drainage therapy, brain curriculum, Astrocyte therapy. So if I go an article on research, brain or lymph, you have, this is very special. This one, this second article will review everything. And this one, this is pretty updated there, the first one. We have 2 big articles already. Lymph in the brain, 2016.